Mechanical receptors are stimulated by physiological factors. Example, if the lungs are exposed to irritants like aerosols or particles, these receptors will initiate a cough reflex to get those irritants out. The body also has respiratory defense mechanisms. The purpose of these mechanisms are to protect the lungs from inhaled particles, microorganisms, and toxic gases. There are a couple of different defense mechanisms. The first one we will talk about is air filtration, which is done by the nasal hair and mucus. This is really your first line of defense. The purpose of the nasal hair and mucus is to trap any particles or microorganisms that are trying to make their way into the airway. Next is the mucociliary clearance system. This is where mucus and cilia work together. So the purpose of mucus is to trap particles, and the purpose of cilia is to move those particles up and out of the body. Next is the cough reflex, which is of course to remove secretions. Last, we have alveolar macrophages. Their job is to trap and destroy particles and bacteria. This is also hindered by cigarette smoke. So if you have a patient who is a smoker, they will not be as well protected because their defense mechanism here will not work as well. Some things that can hinder the mucociliary clearance system are dehydration, smoking, alcohol, and anesthesia. What these four things have in common is that they all hinder cilia action or cause thicker mucus. We know that thicker mucus is harder to expel, which is why we have patients stay hydrated to keep that mucus thin so they can cough it up easier. As with every body system, there are some age-related changes. Things naturally do not work as well as we age. One change could be alterations in structures that make it harder for the lungs to inflate. So let's think about this. Your rib cage has some cartilage on it, and if you have calcifications and hardening of that cartilage, your rib cage won't be able to expand as well, which won't allow your lungs to expand as well. So it could be harder to breathe. Then think about spinal changes. If you have an elderly patient who is chronically hunched over because of spinal changes, they may not be able to take as big of a deep breath as we would like them to. Older adult patients also have alveoli that are less elastic, which makes it harder to inflate and have that good gas exchange. Older adults also have alterations in defense mechanisms. They often have decreased immune systems. Their alveolar macrophages and cilia are naturally less effective. If they are a smoker, this defense mechanism will be hindered even further. Older adults also usually have a decreased cough strength. They don't cough as well as we would like them to. They typically also have drier mucous membranes because dehydration is common in the elderly population. We are concerned about this because drier mucous membranes means less mucus to trap bacteria and particles. We also see that there are alterations in respiratory control. Older adults have a slower response to acid-base imbalances. The body just does not send signals to increase or decrease the respiratory rate as quickly as it does in the younger population. Smokers are more prone to respiratory infections because of an alteration in defense mechanisms. Alveolar macrophages are hindered by cigarette smoke, so they cannot trap and destroy bacteria. If a patient has a productive cough, some things to assess are the amount, color, consistency, and odor of the sputum. The correct answers for this slide is to match thick sputum with dehydration, thin sputum with a postnasal drip, and frothy pink-tinged sputum with pulmonary edema. We've already talked about how dehydration can cause the sputum to be thickened. If you think about a postnasal drip, there's usually a lot of thin mucus, so that makes sense as well. We haven't really talked much about pulmonary edema yet, but what this is the vascular space is overloaded, so that fluid leaks from the vessels into the lungs, and you end up with fluid inside of the lungs. That fluid mixes with mucus to give you the frothy look to the sputum, and the pink tinge comes from it leaking out of the vessels. If a patient has to sleep sitting up, we would use the word orthopnea to describe it. Thinking back to cardio, a cardiac problem that could be responsible for this is congestive heart failure. These breathing patterns are a review from fundamentals, so let's talk about the correct answers. Cheyne-Stokes should be matched with alternating periods of apnea and deep rapid breathing. Kussmaul respirations should be matched with rapid deep breathing. And normal respirations should be matched with inspiration that is half as long as expiration. If you look at the picture on this slide, it will show you where you should expect to hear each of the following breath sounds: bronchial, bronchiovesicular, and vesicular. This slide is just a review of some adventitious breath sounds that you should be familiar with. And remember, adventitious breath sounds is just the fancy word for abnormal breath sounds. As you probably know, you can use a pulse ox to get your patient's O2 saturation. This is used to assess their gas exchange and tissue oxygenation. What are some factors that could affect a pulse ox reading? On my list, I have movement, low perfusion, acrylic nails or nail polish, anemia, and cold extremities. ABGs are another respiratory diagnostic. To get ABGs, blood is taken from the patient's artery to assess gas exchange and tissue oxygenation. This helps determine the oxygenation status and the acid-base balance of the patient. It looks at pH, CO2, and bicarb levels. A thoracentesis is another diagnostic test and also an intervention that can be done for your patient who has excess fluid in the pleural space. For this procedure, a doctor uses an ultrasound to guide a catheter through the chest wall into the pleural space to drain out any fluid there. If you look at the picture, that is the position that your patient will always be in. They will be hunched over the bedside table on top of a pillow, so it's easier for the doctor to get into that pleural space. After the fluid is drained, they can send it off to the lab for further analysis. A pulmonary function test is another respiratory diagnostic that can be used. For this, the patient will use a spirometer that will assess their lung volumes and airflow. A normal reading for this test really depends on the patient's age, gender, race, and height. Of course, for a patient that has a much larger frame, we would expect them to have a much larger lung volume than someone with a very petite frame. A bronchoscopy can also be used for respiratory diagnostics. With this, the doctor will insert a flexible fiber optic tube into the bronchi. They can use this for diagnosis, or they can also perform a biopsy. They can also remove things from the airway, such as a mucus plug or a pulmonary embolism or a foreign object. They can even place a stent to open obstructed airways if the patient has something like a tumor. These are just some definitions of different lung volume diagnostics. I'm going to let you read through these because it really is just the definition. Same thing here with these lung capacities. This is really just memorization, so I'll let you read through this on your own. There's a couple different diagnostics that involve radiology. First up, we have a chest x-ray, which is, of course, an x-ray looking at the patient's chest. A CT can be used to diagnose things that are not as easily seen on a chest x-ray. So this gives us a little bit better of a view. An MRI can look at those more in-depth things for diagnosis, like if we need to look at lesions or tumors. A VQ scan is also known as a ventilation perfusion scan. For a VQ scan, the patient actually inhales a radioactive gas, and then they're scanned to see how that gas is moving, and this helps to assess their ventilation and perfusion. A pulmonary angiogram is a very invasive test. IV dye is inserted through a catheter into the pulmonary artery. This is to visualize the pulmonary vasculature. We mostly see this used to diagnose pulmonary embolisms, and they can do intervention to remove it while they are in there. A PET scan is a test that uses glucose to help identify cancer cells because cancer cells consume glucose faster than normal body cells.